Almost every single day I get asked the question, hey doc, I found out I have arthritis. What is it and how can you help? We're going to talk about exactly what arthritis is, the conventional measures of treatment for arthritis, and by the end of this video, when you hear arthritis, you're going to think, I need to go see a chiropractor. So arthritis, there's many different types, from the inflammatory kinds known as rheumatoid or psoriatic or ankylosing spondylitis. This affects more than 62 million Americans every single year according to the CDC, but we're going to talk about the #1 cause of arthritis, which is known as osteoarthritis, which in alone itself affects more than 1 out of 3 Americans over the age of 65. So let's break down the word arthritis. Arthro, meaning joint, itis, meaning inflammation. So you have some type of inflammation within the actual joint capsule. When people have this for long periods of time, they feel pain, stiffness, inflammation, and dis-ease within that actual joint. And so how does this even occur? Think about a chicken bone. We're going to talk about the actual joint itself. You got a chicken bone. At the very end, you have that white nub. That slippery white nub is known as cartilage. When you have 2 of these white nubs, or 2 of the bones to each other, that forms an actual joint. Around that joint, you have a joint capsule, and inside that capsule, you have a slippery protective substance known as synovial fluid. So how does this inflammation or degenerative process, this arthritis, even occur? And really it's from our daily habits, from postural stresses, from getting hit or some type of accident. What happens is it changes the way those joints are moving. So when they should be moving nicely like this, we get some type of postural stress or accident which makes one side get stuck. And as this other side continues to move, that creates irritation and degeneration within that joint. It irritates it to the point where the body responds by laying down more bone as a protective mechanism, and really it increases inflammation within that joint. Inflammation itself is a good thing. It's your body's natural response to improper motion, and so it's there to protect that joint. It increases blood flow, it increases white blood cells, it increases phagocytes in order to clean up any debris within that joint. And you can check out our other videos up here about the 3 myths of inflammation, but the inflammation is there for a reason. So let's not go about taking anti-inflammatories, NSAIDs, Tylenol to decrease inflammation, because the inflammation is good. So we have improper motion within the joint, and over time the body responds to try and protect itself by laying down more bone, which increases the osteophytic process or the wear and tear. It increases the formation of bone spurs. It decreases the joint space itself, all of which leads to pain and stiffness, achiness, and we want to really help that out. If you were to go to most medical practitioners, they're going to do a number of things to help you with this. #1 thing is they're going to try and give you anti-inflammatories. We just talked about how inflammation is good, and the anti-inflammatory is going to change your brain's perception of what's actually going on in that joint, and it's actually going to increase the degenerative process over time. Another thing they're going to do is try to give you a cortisone shot, which is going to make it feel really good. It's going to decrease that inflammation. We just talked about that, and it's also going to change the way those ligaments in the capsule respond over time, decreasing the stability of that joint. So these conventional treatment options are not your best bet. The #1 thing you can do to prevent osteoarthritis and actually start to regenerate that healthy tissue is to see a chiropractor. A chiropractor's job is to figure out exactly what is going on with every single joint in your body. So we're going to check all the joints in your spine, your pelvis, your knees, your shoulders, wherever this might be going on, and put a specific chiropractic adjustment back in to restore proper biomechanics and motion within that joint. And so if you had an area that was stuck, we put that adjustment back in, and now we have proper biomechanics. So you can get proper lubrication in there. We talked about the joint capsule. So now the synovial fluid can be healthy. You can have proper blood flow to that area, and things can start to regenerate. People say, can I even come back from this? And yes, it's living tissue. So there is a limitation to matter. So you don't want to wait, and not ever see a chiropractor until eventually the point where you have to actually get an invasive surgery to replace that joint. But if we get treated beforehand and restore proper biomechanics of that joint, we can prevent this from even occurring in the first place and also slow it down. So we talked about what arthritis is, how that inflammation even occurs. We talked about the conventional treatment methods and how they're probably not your best bet. And we talked about how if you have arthritis or know somebody who has arthritis, you should probably go see a chiropractor as soon as possible. Thank you for checking out this video and the Source sessions. If you like the information in this video, hit that little like button below. Check out our other videos, subscribe to our channel, share this with a friend, and we'll see you guys soon. Thanks for checking out the Source sessions.